Hey guys, it's Dr. Abraham. I'm here with Elizabeth.
Hey there, how are you?
Great.
It's a pleasure being here with you today.
Oh, love having you. Thanks for
Love
coming.
it. Thank you for having me. So today we're talking all things Botox, right?
Botox, but not wrinkles.
Not wrinkles,
We're-
but Botox generally.
Everything else.
Everything else. Okay, I love it. So Botox is one of my personal favorite treatments, both for myself and for my patients. So I guess let's kind of go way back when it was developed, yeah?
For
So,
sure.
Yeah,
Let's start there.
yeah, Botox was developed in the 1970s as a medical treatment for the condition of strabismus. So for those that don't know what that is, it's actually the condition of having crossed eyes, and it's been shown to have amazing results. So after that, the history behind it, they were doing more medical practices and studies, and it's just shown to treat 9 different amazing medical conditions. One of them, I guess, that we also treat here is hyperhidrosis, the sweating, chronic migraines, so a little bit of everything. So it is truly amazing for medical conditions. So
Yeah, absolutely. And that's because when people hear Botox, the first thing many people are going to think of is, wrinkles, forehead wrinkles, crow's feet, that kind of stuff, which Botox is great for. And that's what we see a lot of clients for. But many people are not aware of all these extra or
Right.
other uses for Botox. You already
Exactly.
mentioned a few.
yeah. So it does have the both medical and cosmetic benefits. So
And in terms of the cosmetic stuff, it just also this speaks to the potency of Botox, but also to the safety of it. Because with a lot of these treatments, we use, many times a large amount of units. So many times when people are doing, few units and aesthetics and stuff, and they're asking about the safety and stuff, and we have all these safety studies from, it's used on aesthetics, but all these other uses that we've talked about and that we're gonna dive in a little bit
Definitely.
deeper
yeah.
into today.
So Botox is actually FDA approved for the 9 medical conditions, which 3 of them I've mentioned, but there are many others. And also in 2002 became FDA approved for cosmetic reasons. So the traditional
Awesome.
fine lines and wrinkles, the crow's feet, all of that stuff. So it is very safe. It's effective. It is essentially, so if we want the breakdown of what is it exactly,
Yeah.
so it's a bacteria known as Clostridium botulinum. So that specific bacteria, it acts as a toxin that essentially inhibits the interaction between nerves and muscles, so AKA relaxes the muscle. So, but treated locally, it is very safe and effective, and it is not a permanent treatment. It is more temporary, as some people may wish for it to be permanent. It's not
sure.
always. So it does last about 3 to 4 months, depending. Dose equals duration, usually with the toxin. So that's something that I always talk about with patients. But go ahead.
So as you've mentioned, it is extracted or is produced from that bacteria, and that's kind of how it was discovered. Um, and it's a specific protein that's kind of produced from there. But you've mentioned that there's 9 medical treatments. Maybe we can go through some of these treatments, because honestly, a lot of times people have these conditions. Some of them, as we'll see, are very common, and they've tried different treatments, not realizing that they can actually do Botox for them. And we see these clients many times where they come in and then they've tried all these different treatments, then they try Botox, and in many cases it's like it could be the answer for many of these conditions. So if you are listening to this and you have one of these conditions, or if you have a family or a friend who has one of them, then make them listen to this, or have them ask about Botox, because as you'll see, like, these are very common things that you probably know somebody that suffers out of them, whether it's like migraines, sweating, muscle spasm in certain areas.
Correct. So in the medical spa setting, the most common medical conditions that we see, I would start off with migraines. So a lot of people, they don't realize their migraines start with TMJ. So your jaw muscle, essentially. So when you clench, you get that headache effect. So that's a very common area that can be treated with Botox. And then another big one that I see often is hyperhidrosis, which is just sweating, essentially. So in the hands and the feet, under the armpits, those are the most common areas. And honestly, Botox can be truly life-changing for people who, it inhibits them from having happy daily lives because you're sweating and you don't want to shake someone's hand, or your feet are sweating and now your feet are slipping out of your shoes. So
Or you can't wear a certain dress or certain clothes
exactly.
because of all the excessive sweating in the
Exactly.
underarms.
Exactly. So it truly can be transformational to your daily
Sure.
life. So
Yeah, migraines is definitely a big one. And as you've mentioned, there's, the TMJ, the masseter muscle, which can cause, sometimes it can cause migraines and headaches. Sometimes it just causes like teeth grinding, which can be bad for your teeth in the long term. And many people will wear a night guard for these reasons. It can cause tension and pain in that area. And, a lot of times Botox can be a very effective treatment. But even migraines that's unrelated to that, whether it's in the posterior neck or in the forehead or in the temporal region, Botox can also be used for that, and we do that treatment often, and we've seen really great results with it. Sweating, as you've mentioned.
definitely.
What are some of the other ones?
So another one is muscle spasms. So like restless leg syndrome, that can be treated with Botox, or just like stiffness in the traps, that can be treated. But that also has its benefits of what we call Barbie talks now. It slims the neck. So there are amazing benefits to it. I've also treated someone's calves before. They felt that they're too large, uncomfortable, or they couldn't fit in their boots. You can treat the calves to shrink
Wow.
the calves. So there are so many areas. Anywhere essentially that you have muscle that you don't mind it to be relaxed or shrunken,
Yeah.
you can treat. So
For sure.
yeah.
Muscle spasm, as you've mentioned,
Muscle
is a big
spasms,
one.
yeah.
Sometimes, and just with the master, we've talked about like it's helpful for the pain and stuff, but some people do it for aesthetics reason, like
Exactly.
slimming the jawline.
Exactly.
Just like with the traps, people can do it for the cosmetic reasons
Absolutely.
and for the medical reasons.
Yeah.
Yeah.
Yeah. So those are more in the medical spa settings, and then there are others that you would go to a specialty for example, urinary incontinence you can treat, overreactive bladder you can treat, just muscle spasticity you can treat. So they're all different kinds of indications for the medication.
That's honestly what makes it so cool, is because like you've already mentioned initially with strabismus, with muscle twitching, muscle spasm, hyperhidrosis. But there are actually even treatments that are kind of semi-aesthetics, but like also not necessarily wrinkle reduction, like gummy smile
Yes.
or a lip flip,
Absolutely.
where we're not actually going after wrinkles, but still has a little bit of a cosmetic benefit.
Yeah, definitely. So lip flip is one of the most common procedures asked for those, especially that don't want to do dermal fillers in their lips. They will ask, can I do a lip flip? I actually love doing a lip flip. It's kind of like the gateway drug in a sense. But so it does have that augmentation like effect essentially. And then gummy smiles I love to treat as well, because that also changes someone's
Yeah.
just behavior, or not behavior, but just how they feel about themselves, like looking into a camera or smiling in pictures. It can potentially, having that gummy smile can potentially prohibit you from smiling in photos, and now all of a sudden you're smiling in every photo.
Exactly.
with treatment of gummy smiles. So another commonly treated area is just like the Nefertiti, so to help contour the jawline essentially, or the platysmal bands. These bands, I haven't treated mine, but these bands here.
The neck
just
bands.
The neck bands,
yeah,
exactly.
Yeah, for sure.
Or the DAOs, like when you look like you're frowning, but now you just kind of always look happy.
Yeah, no, absolutely.
So,
And these things are important because, and again, a lot of times people come in to do Botox and, just comes up that they have this gummy smile that like really bothered them, and they're not even aware that just 2 small quick injections of Botox can
Exactly.
really help the issue significantly. And, sometimes they think that the only way to do it is, to do like surgery or certain things. But many times, again, depending on the case, just a couple quick shots of Botox can change it, and for that person, they can be a huge difference in how comfortable they feel. As you mentioned, smiling on camera and doing all that stuff.
Exactly. There's
Yeah.
a lot of room to play around with the medication, and you can have a lot of fun with it too. It's temporary, so it's, you know, if also, like, let's just say you don't like the result of something, it does not last forever. So you just talk with your provider, and you can come up with a protocol or a treatment plan to see how we can potentially treat your concerns. And if you don't like, for whatever reason, you don't have to do it again. So
Yeah. And for some of the stuff that we've talked about, it can be like really powerful. Like a lot of times it's kind of one of the last things that the patient come in trying. So for like headaches, I've seen honestly many people who's, you know, have been suffering with headaches for years and tried all different kind of medications and stuff, and it just affects the quality of their lives like significantly in a negative way, having to deal with all of these headaches. And then Botox can be like life-changing for them.
it absolutely can be.
A jawline too. I mean, people with the, you know, masseter, with that jawline muscle that we've talked about, and all that teeth grinding and pain in their jaw that comes from there, and not having to wear the night guard every day. Hyperhidrosis with the sweating, it can be very effective for that. So it's, you know, it's an effective treatment for a lot of these things.
Absolutely. For those patients that I have who do suffer with those conditions, every single one of them thank us for our you know, our service to truly help them with their daily lives. So
You know, one of the really cool things about Botox too is like all these treatments that we've talked about is there's probably going to be more things coming out in the future. I know, like right now, one of the coolest things is that there's some studies and stuff that show that Botox can actually help with depression and things like anxiety.
Yeah.
Now we're not, you know, as of now, we're not treating depression with Botox, but there is some, there's definitely some research there that suggests that there's a, you know, correlation between reducing symptoms of depression and episodes of depressions with Botox, and it's something that's being looked at, and I think in the future might be another thing that Botox is used for. So I think that's really cool, you know.
yeah, I mean, it's also like a look good, feel good situation. I'm sure has part of you know, part of.
And
the
I think
effect
there's
of it.
still some questions about exactly how it works, but at least partly it could be because when you're not, you know, like one of the most commonly done area is the glabella, where we sometimes call it the 11 line, that area between the eyebrows, where we tend to use when we're frowning and stuff. And the part of it might be that, you know, feedback loop between our brain and our facial expressions. So if you're not frowning as much, if you're not doing these certain muscle movement as much, there might be some kind of feedback where we don't feel these like kind of angry and mad emotions as much, since we're not doing these facial expressions.
It's kind of like body language. Like when you
Exactly.
look at someone's body language, you can tell if they're angry, if they're happy, if they're uncomfortable. So body language also includes your facial language. So
100%.
all of that can definitely have an effect, you know, play a role in the whole scheme of it all.
And it's two-way road. Like however you feel can reflect in your body language, but whatever body language you are in will also have its effect back on how you feel. So like even people will notice they'll be sitting a certain way, and that just changing their posture or the way they're sitting, the way they're standing can have an effect on how they feel. So, and you know, whether that's exactly how it works or not, I think there's still some question there, but there's definitely, again, that possible relationship between reducing, you know, symptoms of depression or even anxiety by doing Botox, which I think is, you know, it's cherry on top.
Yeah, exactly. Actually, there's a big topic I always like to talk about is Botox is used. The name Botox is actually a brand. It's a type of toxin. So I always like to discuss all the options. So Botox being the umbrella term of the neurotoxin used, the medication, there is, of course, Botox. There's Xeomin, Jeuveau, Dysport, Daxxify. So those are the 5 different toxins available in the States and available at New Med Spa. So I always do like to talk or mention those because people like to know their options, and essentially it's all the same, just semi-different formulation, but sometimes people have a preference one over the other. But
no, that's a great point. That is absolutely a great point. A lot of times we're using Botox, but really, and part of the reason we use Botox is the kind of initial product that was used is what later became as Botox. So it's been around the market for the longest. A lot of the research has been done with Botox, but it's not the only neurotoxin that is available, here in the States, as you've mentioned. So there are other options that are very similar and likely have the, similar effects on all the stuff that we've talked about. Again, certain research was done with Botox only or with other neurotoxins, but there are 5 different neurotoxins that are available as of now in the US. So sometimes, it doesn't have to be specifically Botox. It's kind of like sometimes we use Kleenex for tissue paper, but there are other brands.
Exactly.
Same kind of thing.
Yeah.
Botox was first to the party and the name kind of stuck.
So we've talked all things Botox. Now, who is the ideal candidate for Botox? Do you have an opinion on this?
Well, I think this is honestly where that consultation plays a key role, because it's not a certain age. You can be a certain age, or 2 people can be, a specific age, and one person might really need it. The other person with the same age might not need it at all. And it depends on what are we talking about. Are we talking about wrinkle treatment? Are we talking about hyperhidrosis? Are we talking about headaches? I think if you are suffering of any of the things that we've talked about, you definitely should, consider it, have that conversation with your provider, see if you are a good candidate for it. It's hard to just say, over the podcast, especially when we've talked about all these different indications, who would be, a candidate for what. But very few people are, completely can't get Botox. It's rare that the situations where somebody might not be a candidate for Botox at all. So more people than not could be candidates for Botox, again, especially if you are having one of these problems that we've talked about.
Right. I guess the only people I would not treat, I just would not treat, are those who are pregnant or breastfeeding.
Sure.
Or have a true allergy or known allergy to the medication, and that's kind of really.
Yeah, sure.
For
Those
the most
are,
part.
yeah. I mean, there's
That's
some
a
rare.
foundation.
Yeah, exactly. That's a good place to start with most, especially when you're doing the cosmetic treatments.
Correct.
Yeah. So, but I do think it's definitely on a base-by-base cases. But chances are, if you're a healthy adult, you probably could be a candidate. So you should, again, just have that conversation, have that consultation. If you're not, at least you've learned about it, you've asked.
Yeah. So feel free to come on in and have a consultation with us.
Absolutely.
Or any of the providers with NewMed. So.
Absolutely.
Yeah.
Well, it's great having you here. Thanks for coming.
Thank you so much, Dr. Adam. It was a pleasure.
Thank you. Thanks, guys, for listening. Make sure you like and subscribe, and we'll see you next week.